afternoon. I'm Elizabeth Hartig with the American Planning Association, and I'm here today with Ann Forsyth. Ann is a professor of urban planning at the Harvard Graduate School of Design. Welcome, Ann.
Oh, it's good to be here.
So let's start off with hearing a little bit more about you. Could you tell us a little bit about your research and how you got involved in healthy community design?
Well, the basic area of my research is to look at the social aspects of physical planning and urban development. And over the years, the area where I've looked at most of that has been in suburbs and planned communities. I started off being initially interested in both how people related to places, particularly housing, and also in sustainability. And some of my early books were about how sustainable new towns were. But of course, sustainability is not just environmental, it's also a social and economic issue. And so I had crossed into the health arena quite a bit. And then about 15 years ago, the interest in health really blossomed, particularly through Robert Wood Johnson Foundation and others being interested in the obesity crisis. And that gave me an opportunity to use the work that I'd already done on how people related to place and on sustainability to transition into engaging issues of health. And I started collaborating with people from public health. And I've had some fantastic collaborations over the years where I've learned a lot through working with people on research projects. Most of my research projects have been on the area of physical activity and food environments. But as I worked in this field, I came to realize that there was a lot more to it. On one hand, there are many more connections between health and places than just physical activity and food environment. And in the book that we're going to talk about, we point out that there are relations to do with exposures, particularly exposures to bad things, pollutants, accidents, toxics. Also relationships to do with connections to the people and resources you need to lead a healthy life. And finally, supports for behaviours. And so that ranges across a wide variety of subject areas, from the mental health benefits of seeing nature through to issues of air pollution. And so in a second area of my research, I've focused on translating current research into guidelines for practice, and also creating tools that help planners engage the multiple areas of health in their practice. And that's been creating health assessment tools, research summaries, and books like the Healthy Neighbourhoods book.
That's fantastic. So it sounds like you're not only building the evidence base, but you're also making it easier for planners to do their jobs on a day-to-day basis.
Well, that's actually the very tricky part about it, because there's actually a huge amount of research out there broadly about the area of how health relates to place. If you put city and urban and rural into the PubMed database, one of the big research databases that's online, you get literally hundreds of thousands of references. But some of them have only a very tangential relationship to the kind of work that everyday planners do. So there's actually a really important job that I think academics can do of translating this research into usable guidance for practice. We can really help planners sift through and figure out what the balance of evidence shows, figure out what is a higher quality result, figure out where the sort of planning toolkit can make a difference and where other interventions are important. Because in fact, when we think about our health, the environment does matter, of course. We live in an environment and react to it. But really at the base, our health is related to our biology, how old we are, our genetics, our gender, the behaviors we do, whether we kind of abseil down cliffs for a hobby, or whether we smoke. And then a number of social factors. Our education, our social connections, the networks we have, the sort of opportunities we have to engage information and so on. And in fact, if I had to tell you one thing to do to be healthier, I'd say get educated. It's really important because then you know how to use an environment well and you know what makes a healthy behavior. On the other hand, environments are important, and planners can have a role in creating either environments that aren't going to make people ill by sort of reducing exposures to sort of bad things, by helping people connect to resources through transportation, universal design, and so on, and also through creating supportive behavior, supportive environments, so that when people want to behave in a healthy way, they want to be physically active or find healthy food or be in a safe environment, we've created an environment that will allow them to do that.
That's great, making the healthy choice the easy choice.
Yeah, I suppose so. That's actually a good way to look at it. Actually, sometimes the healthy choice is a little less convenient than the unhealthy choice. I could take the escalator or I could take the stairs. It's a little less convenient to use the stairs. It's much better for me. So actually part of what we're trying to do is both create an environment, but we also need a set of educational materials and information that help people know how to use those environments.
Great. Well, and certainly as a professor, you have the opportunity to shape future planners. What types of courses do you teach, and how are you thinking or seeing the next generation of planning evolve?
Well, I actually teach classes in qualitative research methods, which is the most fun class I teach because it helps people look at environments and sort of analyze them systematically. A class in healthy places and a class in environmental planning. But in the past, I've also taught a lot of workshop and studio classes where people do practical projects. And I particularly like those classes because that's where professionals, young professionals, can learn how to engage communities and engage environments. In terms of where education is heading, it's very interesting that in the latest revision to the accreditation criteria, they added in health as a value. Health has not been a criterion for judging our curriculum until now, at least not a major criterion. So actually from 2017 on, all planning programs around the country that are accredited will need to show how health is being integrated as a value into their curriculum. And I think that's going to be a very interesting process to see how the various programs do that. Obviously, there are these substantive issues to do with health, to do with exposures, connections, and supports. But there's also issues about how we build health into the process of planning, into how we do our analyses, how we frame our questions, and so on.
And that's a great segue to start talking about your book, your recently released book, and perhaps you could talk a little bit about process and strategies and how you've incorporated that into the text.
Well, Creating Healthy Neighborhoods was one of 3 books coming out of a project that we did at Harvard over a 3-year period where we were looking at how health and neighborhoods are connected. One book that I co-authored with Peter Rowe and Hayi Khan analyzed neighborhoods in China. Another one looked at design principles. Creating Healthy Neighborhoods is really a how-to manual that tries to translate this important research on healthy neighborhoods into guidance for practice. But it's in 2 sort of parts that I think make it unique in kind of the marketplace of such books. The core of the book is, of course, focused on the substance of how you connect health and place. We think about the vulnerable groups and how different kinds of people relate to place in different kinds of ways as a central framing principle. This is a core principle for public health people and also in thinking about healthy neighborhoods. And then we look at overall neighborhood layout, at connections, at access, and at protecting people from harmful exposures. But the book begins and ends with sections on process, on how to decide if health is an important issue, then how to figure out what kinds of health issues are going to be most important in that particular neighborhood, and at the end of the book, how to implement the ideas about healthy neighborhoods. And one nice thing about integrating health into urban planning is it brings a new set of partners into the table. Not only people from public health, but people who are interested in health in other fields, in the environmental field or the transportation field. And others more generally, aging, social work, and so on. And one of the nice things about health is that very few people are against health. They may be worried about, they may be not so concerned about environmental change, they may think demographic issues are too difficult, but most people are interested in health. And so it's actually a very good way to bring people from a lot of different value systems together to focus on a common goal of trying to make better places at the neighborhood level.
Great. And as you're talking about the design of the book in terms of having process sections as well as an overarching framework, you also have lots of images and charts and graphs. Are you hoping that this is a book for practicing professionals then of all stripes, or do you think this will be for students?
Well, I'm hoping that it's both for practicing professionals and students. The book has a clear structure and could be easily used in a sort of a studio workshop format, so you could go through the various sort of stages of a planning process and use the book in that way. But we designed it to try and be as engaging as possible in doing this translation work, because we're pulling material from a lot of different fields and we wanted to make it as accessible as possible. We also wanted to let the practitioner readers or the student readers understand some of the nuance, because in some areas there are very clear kind of thresholds or standards that you can have for sort of what kind of environment you need to make. So some aspects of air quality are of this sort. You know, you wouldn't want to put a childcare centre within 500 metres of a freeway with the sort of current automobile technologies that we have. In other areas, there's a clear relationship between health and the environment, but the actual level of your exposure or the sort of amount of access is not known, or is hard to tell. So something like the mental health benefits and the cognitive benefits and the stress reduction benefits of access to nature are widely confirmed. But it isn't clear how much access to nature we need. Is it having a potted plant on your desk, or is it having a wilderness experience? It's certainly sort of more towards the potted plant end, but it's actually hard to tell. And then in some areas, the relationship between health and place is very sensitive to the kind of person who is experiencing the environment. So for instance, with physical activity, working age, able-bodied adults will walk more for transportation in environments that are mixed use, high density, the things that we would call walkable. But for children, an environment that will increase their physical activity overall is more likely to be one that is safe and has recreational opportunities. And then for older people, there are a lot of things coming into play when an older person decides whether to be physically active. They actually may have a lot of health issues that may stop them being physically active outdoors, even if they're in an environment that might be supportive of it. So the relationship between the outdoor environment and physical activity amongst older adults is more nuanced. Those who are physically active may be doing yoga classes or going to the gym and so on. It's just not the clear relationship of able-bodied adults. So we tried to use a number of those graphics to show some of these subtle relationships. And we also drew on a large collection of photographs to kind of show what it looks like on the ground. In addition, while it's a book that was written in the United States and draws on much literature from the United States, we actually had an international or sort of global perspective, so that it draws on work from Europe, Asia, Australia, and elsewhere. And it's because the neighborhood occurs in many different places, and the planning of neighborhoods has some similarities. We're also hoping that it reaches beyond the US, even though it sort of resonates with the US.
Great. And I know you started your comments talking about the holistic definition of health that you've certainly taken on. And for planners out there who maybe don't immediately see themselves as public health practitioners or aren't quite sure how to make the connection between mental health and the work that they do you have any advice, or could you talk a little bit more about the importance of social connection or providing that type of support?
Well, there's actually a few ways that planners can make those connections. There's a sort of connection in terms of the substance, but also in terms of their workplaces. One of the problems with planning in the United States, with making connections to health, has actually been institutional, because in many places planning occurs at one level of government and the public health agency is at a different level of government. And so you have a city planning agency and a county health department, for instance. And so not only do you have to reach across fields, you actually have to reach across government agencies, and that makes it really difficult to make those connections. But there are many people in public health who are looking for ways to make a difference. So it's important to see who you can reach out to in health, because there's probably a willing partner somewhere. But it can be difficult if you have to go beyond your area. In addition, public health people do a lot of research fairly routinely. They do community health needs assessments and so on, where they survey folks and look at the regional area. Some of those actually include planning topics, but many actually focus very narrowly on a traditional range of public health issues. Reaching out to those folks and collaborating on some of the data collection can be a terrific way that you can inject some planning ideas into the health topics, health research, but also get data.
Well, thank you so much, Ann, for taking the time to talk more about your work and for introducing your new book, Creating Healthy Neighborhoods, Evidence-Based Planning and Design Strategies.